One class of anti-diabetic drugs has changed the treatment of both diabetes and heart failure. Welcome to the world of SGLT2 inhibitors. In this video, we'll understand what SGLT2 inhibitors are, how they work in the kidney, the clinical uses, major side effects, precautions, contraindications, dosing guidelines and possible interaction. SGLT2 inhibitors stands for sodium glucose co-transporter 2 inhibitors. They have glucose-lowering efficacy along with cardiovascular and renal protection. They lowers both fasting plasma glucose and postprandial glucose levels. They act independently of insulin. Now let's look at the mechanism of action. SGLT2 is a transporter located in the proximal renal tubule. It is responsible for reabsorption of filtered glucose from the lumen back into the bloodstream. SGLT2 inhibitors blocks this transporter, thereby decrease glucose reabsorption, increase urinary glucose excretion and increase sodium excretion. This contributes to reduced plasma volume, lowers blood pressure and decrease preload and afterload. To summarize in simpler words, SGLT2 inhibitors lower blood glucose by blocking renal glucose reabsorption, causing glycosuria, natriuresis, reduced intravascular volume, and thereby produces renocardioprotective effects. The drugs in this class includes canagliflozin, dapagliflozin, empagliflozin, ertugliflozin. The major clinical indications where SGLT2 inhibitors are commonly used: in type 2 diabetes, in chronic kidney disease that slows progression, also in heart failure with reduced and preserved ejection fraction that ultimately reduces hospitalization and mortality, especially empagliflozin, dapagliflozin. Like all medications, SGLT2 inhibitors have certain adverse effects. That includes urinary tract infections, nasopharyngitis, female genital infections, hypotension, DKA, Fournier's gangrene, lower limb amputations, AKI, bone fracture, hypersensitivity, polyuria, dehydration, hyperkalemia, dyslipidemia. For better retention, we can summarize the key adverse effects using a mnemonic: glucose loss. Now let's move on to the important precautions to consider when using SGLT2 inhibitors. Should be cautiously used in older adults as it has increased risk of euglycemic DKA. SGLT2 inhibitors not be used. Here are the key contraindications you must remember. eGFR less than 30 megaliters per minute, hypotension or dehydration, pregnancy or lactation, diabetic ketoacidosis. Things to consider before dosing: assess renal function prior to initiation, assess volume status or correct volume depletion, assess blood pressure. Now let's look at the important drug interactions associated with SGLT2 inhibitors. Diuretics may interact with SGLT2 inhibitors and may contribute to enhanced volume depletion. With insulin or sulfonylureas can lead to risk of hypoglycemia. Rifampicin, phenytoin, ritonavir may decrease efficacy due to enzyme induction. That's all for today's topic on SGLT2 inhibitors. I hope this helps in understanding the pharmacotherapy better. Take care, keep mastering, keep learning, only on Mastering Meds.